beyond all expectations, and they continue to challenge themselves and others to be the best that the nursing profession has to offer. Now, as you know, many of you have been to this event before. For each of the gold medal winners, we will show you a video that just captures a little bit of their lives and the reasons why they were selected as the gold medal winner. And actually, I would ask following the tribute, the video tribute for each person, we'll be inviting them on stage to receive their award. So first, join me in watching the video about the winner in the category of clinical practice in a large hospital. And the winner in this category is Jennifer Freeman Price from MD Anderson Cancer Center. Woo!
Price. I have been a nurse for 10 years in stem cell transplant and have been at MD Anderson for 7 years. As the charge nurse of the 48-bed acute care stem cell unit, she's responsible for the work environment of over 170 staff members, as well as measuring and monitoring the quality and safety outcomes for nursing care, patients, and staff. Jen, I would say, is kind of a polite bull. She is this, tiny person that walks into a room and just takes it over. She maintains the professionalism and the politeness, but while really pushing for what she thinks is best for whomever she's taking care of.
I think that in everything she does on this unit, she remembers that our end goal is for the patients.
I'm very passionate about not sticking with the status quo. There's always a better way to do things. There's always a better answer, a better solution to a problem.
The place that Jennifer most shines is in dealing with complex patient situations. She is fearless when handling highly charged situations with patients. We had a patient who developed a terrible complication called Stevens-Johnson syndrome. This patient slept his entire illness 100%.
For skincare, it's always been, with our stem cell transplants, at the bedside, we pre-medicate with pain medication and then do the dressing changes. But his skin damage was so extensive that it was so excruciatingly painful for him.
So Jennifer took this on single-handedly and organized with multiple departments to coordinate 3-hour dressing changes to the operating room and did these under anesthesia.
Every single day, we would coordinate eating nurses, nursing assistants, dermatology.
We as the medical team were asking very difficult things of both bedside nurses and the institution in general. We were asking people to bend rules, and Jen was the one who was the muscle. I mean, she was truly the one that made the things a reality for the patient.
Watching how all the Southeast nursing pulled together to do that, because it was a big resource strain, was really inspiring to see them put forth all their effort to give them the best care that they could.
She is probably the most dedicated nurse I've ever had the privilege of working with. She's involved in countless projects.
The past 2 years, she was the head of our patient satisfaction group and has taken our scores for nurse responsiveness and nurse communication from mediocre to stellar.
The perfect role for her would to be continue to climb the ladder and to move into a formal leadership role.
I fully expect her to have my job someday. She's studying for an advanced degree in nursing administration.
My biggest mentor has been Roxy Blackburn. People kind of laugh and say, well, mini Roxy, but I've developed really strong as a clinical nurse, but now I'm trying to move in towards more of a leadership role, and she's been like, kind of guiding my.
Jennifer balances her career with a lovely young family. She has a 2-year-old daughter.
We did get to have our first little mommy's a nurse type moment. She has a little stuffed whale that the dog chewed, and she was really sad about it. So we got the gauze and cut the tape, and we got to wrap up the tail and fix it. And my husband came in and was like, "Oh, this is what mommy does," and she was just really proud and just really excited that I fixed her whale, and then just like, "Oh, that's what you do," and so that was a really, really sweet moment.
Congratulations, Jen. I cannot think of anybody who's more deserving of this award.
I cannot tell you how proud I am to have nominated you and that you are a winner of this award. The entire community of nurses at MD Anderson congratulates you.
I am so happy for you, and you should own this because you absolutely deserve it.
Congratulations, and would you like to say a word about this award?
Samaritan Foundation for finding me worthy of such a prestigious award. I also want to thank MD Anderson Nursing Leadership for who believed in me enough to nominate me. So thank you especially to Roxanne Blackburn and Dr. Kelly Brazel for the nomination. When I heard that I was the gold medal recipient, I was of course excited and proud, but I was also kind of overwhelmed. It was difficult for me to internalize and justify to myself that I truly deserved it. It's a really huge honor. I mean, such a huge honor that it's just kind of hard to take in. I look around at my peers that I work with every day and see such greatness in every single person that I work with. And many of them excel in ways that I never could achieve. And, you know, I'm not the nurse who works to put in your IV. I'm not the nurse that, when patients are crying, has the right things to say. I actually kind of get a little awkward when patients' tears start rolling. But I am an expert in stem cell transplant, but I could put a trach or a chest tube in front of me and I'm running to Mosby's to tell me what to do. So winning this award really kind of forced me to do what nurses in general are not very good at. And I had to look into myself and think about what truly makes me special and unique as a nurse. What qualities do I possess that make me worthy of winning such an award? And what really is nursing excellence? Through my soul searching and trying to figure out, wrap my head around this award, I figured out that to me, the heart of nursing excellence can be found in a nurse's passion. When people describe me, it is generally something along the lines of, Jennifer is really passionate. Sometimes that's meant as a compliment, other times not. I'm not only passionate about providing our patients and families with the best possible care, but I've also, as I've grown as a nurse, clinician, and as a leader, my passion has extended to quality improvement, patient satisfaction, and education. I think what really sets me apart is when I see a problem, I don't stop until I find a solution. I think Alyssa said it nice and I'm a light pole. I'm never satisfied with the status quo. There's always a better way, and I will relentlessly search for that better way. It's kind of like my personal search for the Holy Grail. I truly believe winning this award is a true testament to how meaningful and influential that nursing leaders can be. At MD Anderson, our leaders follow a transformational model of leadership, and my mentors have always developed and guided my passion without ever stifling it. And I want to take what I have learned from them and help pass it on to the newer generation of nurses and let them know that they have a voice, and that if you use that voice, you can accomplish great things. And I just want to thank, I just want to thank MD Anderson and my mentors for letting me shine, and thank you again to the Good Samaritan Foundation for honoring me, and also thank you to my husband and my awesome daughter Ellie for supporting me through this career journey in school and all that. So thank you.